Yes, we have a
Hello, and welcome to Hello Live. I'm Pamela Hadfield, the co-founder of HelloMD, and today I'm joined with Dr. Patricia Frye, our Chief Medical Officer. Welcome.
Thank you.
And today we're going to talk about cannabis and autoimmune diseases. You know, we still don't know exactly what causes most autoimmune diseases, and unfortunately, as we've talked about, most of the medications on the market today just aren't cutting it. So before we dive in, I'd actually love for you, Dr. Frye, to talk to our audience and tell them a little bit about your history and why you're here today with me.
All right. Well, I'm trained in pediatrics and in anesthesiology. And a few years ago, I took a job with HelloMD as a cannabis consultant.
As our first doctor?
First doctor, and that was my first introduction to cannabis medicine. And
I remember it very well.
It took a while for me to really learn this plant and to learn how it was helping patients. And I've gone on and started practice on the East Coast, and so I see a number of patients with all kinds of conditions that typically respond to cannabis. And last year I wrote a book on medical cannabis. It's called The Medical Marijuana Guide, Cannabis and Your Health. And that explores not only a number of clinical conditions that tend to respond to cannabis, but also the history of cannabis as medicine, a little bit about the science of cannabis and the endocannabinoid system, and how patients can improve their own endocannabinoid tone and take steps to feeling better.
And I read a lot of cannabis books because there are so many books on the market today. And I have to say, what I love about your book is it goes into such great detail about so many different conditions that, frankly, most doctors, I would say, don't have that kind of experience with. And over the years since I've known you, it's been 4 or 5 years at least now, you have seen thousands and thousands of patients. And due to your own clinical practice and working here at HelloMD, it's amazing to see how much experience you have and how much knowledge. And so you can be humble, but I'm going to say that Dr. Frye is one of the nation's leading experts on cannabis and a cannabis clinician.
Thank
it's nice
you.
to have you. Anyway, so let's dive right into the first question. And I think this is a more general question, just so that we can set this show up, which is, what exactly is an autoimmune disease?
Well, an autoimmune disease simply means that the body is responding to its own parts in a way that it would if it were a foreign object. So that there are molecules, there are situations that can stimulate that immune system, and the immune system's job is to clear the body of things that aren't supposed to be there. But when it gets confused, it starts attacking its own parts. And causes symptoms. So that's basically what an autoimmune illness is.
And there are types of autoimmune diseases. So maybe you can cover some of the most common ones so that our audience has a grasp of what they are.
Yes, of course, lupus, multiple sclerosis, rheumatoid and psoriatic arthritis, mixed connective tissue disorder, fibromyalgia is considered to be an autoimmune illness. Type 1 diabetes, Hashimoto's, which is a thyroiditis, celiac disease, which is gluten sensitivity, and things like interstitial cystitis we see quite a bit of, Sjogren's syndrome, which is drying of the mucous membranes, is thought to be autoimmune, as well as a ankylosing spondylitis, which can cause chronic back pain even in young people.
And the list goes on and on and on. And I think we were looking at a fact before, which was that there are between 80 to 100 autoimmune diseases that are recognized, and I guess that depends on who you're talking to, and at least 40 more that they suspect have a basis in autoimmune. So that's a lot of different conditions.
It is.
So I'm going to give you a did you know fact.
All right.
Are you ready for it?
I'm ready.
Okay. So the National Institute of Health, the NIH, estimates up to 23.5 million Americans suffer from autoimmune diseases, and that those numbers are rising. I had no idea that it was so prevalent.
It is very prevalent. I didn't know the numbers specifically, but we do see a lot of autoimmunity, yes.
And so if these numbers are rising, is there any indication as to why this is happening?
I don't know that it is clear cut. I have my own thoughts. I think that there are a lot of things in our diet that affect the health and integrity of our intestines. And through that, we absorb molecules that really shouldn't be absorbed into the body, and these can stimulate autoimmunity. I think some of the numbers are rising because we are recognizing them as autoimmune illnesses, because there are other things like, I didn't even mention Lyme's disease. There are infections that can cause the body to react against itself. Pandas, which is associated with a strep infection. So I think a lot of it is the food. I think that we have a problem with the highly processed foods in our diets and the foods that are manipulated. But I also think that we are, as physicians, recognizing a lot more conditions as having an autoimmune basis.
Well, that's a great answer. And I just want to remind everyone in the audience that Dr. Frye is here today to answer your questions. So if you have a question about cannabis and autoimmune diseases, please type it into the live chat. And we will have somebody that will feed me the questions. And we're not going to be able to answer every question, but if we don't get to your question, Dr. Frye and our HelloMD doctors will be standing by afterwards to continue to answer those questions. So another general question about autoimmune diseases. What are the physical and mental impacts of an autoimmune disease, and how do they affect people's daily lives?
Well, everyone is affected differently, so it would be difficult for me to say speak in specifics about that, but generally patients will experience, let's say, mood changes, irritability, chronic pain. That can often be joint pain, but it could also be muscle pain, or they have trigger points, which are areas in the body that are always painful. It can affect sleep, irritability. Patients with autoimmune issues commonly speak of kind of a mental confusion that they call brain fog. It can affect libido.
It just
GI
runs
motility.
the whole gamut.
It does.
It doesn't sound like it's a pleasant experience.
No, it's not, and of course, like in any medical condition, you have varying degrees of severity. So some patients may be mildly inconvenienced by some symptoms, and then for other patients, it could be quite debilitating.
Yeah. Well, let's jump right into how can cannabis help with autoimmune diseases?
Well, cannabis is a plant that's, it contains some compounds that are only found in the plant that we call cannabinoids. There are about 150 of these different compounds in the plant, and we really don't have a full understanding of how they all work. But CBD, which is a non-intoxicating compound, is known to modulate the autoimmune system. And so patients with autoimmune illnesses take CBD. It can not only treat some of the symptoms they're experiencing, but it can actually sort of down-regulate that immune system and make it not so reactive. So I've seen patients with autoimmune illnesses that take CBD and they find that their symptoms improve, the number and frequency of their flare-ups decreases, the severity of the flare-ups decrease. And they can also use other cannabinoids like THC, which may help with pain relief. Oftentimes, taking CBD and THC together is a good way to approach things like muscle spasm and pain, because that way you can get the benefit of the THC without necessarily being impaired by its intoxicating effect.
And so, just to clarify, CBD is non-intoxicating.
Yes.
And it sounds like what you're saying is that CBD is really the go-to for most autoimmune diseases.
For my autoimmune patients, I strongly advise that they use CBD, if nothing else, for modulating that autoimmune system, for calming that system down, and for its really potent anti-inflammatory effect. Then we use THC. We can add THC in as needed for pain relief and for mood elevation, because oftentimes there's an element of depression when you're ill.
Absolutely. And I actually suffered from fibromyalgia some years ago. And Of course, I thought I was dying because whenever I have an ache or a pain, I think I'm dying. But it went on for some time, and I incidentally started taking CBD for my migraines. It took care of my migraines, and I was pretty surprised to find out that it took care of the fibromyalgia as well. So that was a happy little add-on. Of course, I'm only just one person, and that's anecdotal, but it was quite an amazing turnaround for me.
And I say it anecdotally in a lot of patients.
Are you ready for your next fact?
I am.
Okay. So autoimmune diseases are typically hard to identify and treat. Initial symptoms are often intermittent and unspecific until the disease becomes acute. Symptoms can also cross many medical specialties. What do you have to say about that?
I say that's true, and I kind of knew that. And yes, it can be, it can take oftentimes years to pinpoint what exactly is going on because the expression of the disease can vary so drastically from patient to patient. Oftentimes they see multiple specialists. Eventually they end up with the rheumatologist, and sometimes there are some very special blood tests that need to be done, or some very special imaging studies that need to be done to pinpoint exactly what the problem is. But it can be quite perplexing and challenging, yes.
And so our next question is about cannabinoids. Are you ready for it?
I am.
So how can the cannabinoids CBD, THC, and THCV help folks with type 1 and type 2 diabetes?
Okay, well, type 1 diabetes is an autoimmune illness. Type 2 diabetes is a little different. It's an acquired illness, usually occurs in adults later in life, and is usually associated with obesity. Type 1 diabetes can respond to CBD and THCV. Actually, both of those, we have found that blood sugars can become more easily managed when we introduce CBD and also THCV. THCV we don't use a lot because of its intoxicating effect.
You said it's more intoxicating than THC,
It
correct?
is.
It's also an appetite suppressant.
It is an appetite suppressant, and it does seem to modulate glucose metabolism, but the intoxicating effect leaves it that we really can't use it much during the day. If a patient wants to try something during the day to help regulate their sugar levels, CBD is a really good choice. Oftentimes patients will have to lower their insulin levels or doses.
And that's a good thing.
It is a good thing. Oral hypoglycemics are medicines that are used to treat type 2 diabetes. Oftentimes we have to adjust those doses because the blood sugars and the hemoglobin A1Cs come down. THC can be added to alleviate symptoms that are associated with the illness, let's say if there's pain or depression, or to help with sleep. But we don't see that THC has much to do with glucose metabolism.
All right, well, that's a very thorough answer. And we have our first audience question.
All right.
So it goes like this. If I have lupus and I'm often prescribed prednisone during a flare-up, is that okay to mix with cannabis? What a great question.
It is a good question, and the answer is a resounding yes. It's okay to use them together. CBD is a potent anti-inflammatory. It's 2 to 3 times stronger than prednisone.
Wait a second, say that again. So CBD is more powerful than prednisone.
As an anti-inflammatory.
And that's why prednisone is used, correct?
It's used as an anti-inflammatory, yes, calm down the immune response. And CBD is well tolerated. It doesn't influence the metabolism of a prednisone or any other steroid that might be prescribed. And what happens is that because you have that anti-inflammatory effect from the CBD on board, that the dosing of the prednisone could be adjusted so that you don't have to take as much. And CBD has none of the adverse effects that the prednisone has.
Because there are so many side effects of prednisone.
There are. It causes weight gain. It can cause extreme irritability in some patients. And so it's the more CBD you use, probably the less prednisone you're going to need, and that's a good thing.
That's good news.
Mm-hmm.
All right, so our next question is about MS. What does the research show about the use of cannabis for multiple sclerosis?
Well, MS, or multiple sclerosis, is a condition that has really been looked at rather thoroughly in cannabis research, and they find that CBD and THC both will relax the muscles, so it treats the muscle spasticity that's associated with MS, and it's a pain reliever. The THC also is mood elevating, and the CBD is very good for anxiety. And there is a cannabis medication, Sativex, that's available in a number of European countries, and it is indicated for treating multiple sclerosis.
That's great. And so does it help with the symptoms only, or does it slow the progression of the disease?
Well, we have data that shows that it helps the symptoms, and it's conjectured that it may actually slow down the progression, because these cannabinoids, as you know, the U.S. Department of Health and Human Services has a patent on cannabinoids as neuroprotectants and as antioxidants. And due to its anti-inflammatory effect, and there is definitely neuroinflammation, it's a part of the picture of multiple sclerosis, it very well may slow down the progression of the disease. We just don't have the scientific data for me to say that that is an absolute.
Understood. Mm-hmm. So we have another audience question.
Yes.
I have Hashimoto's, and I'd love to hear more about how CBD may be useful in the treatment of my disease.
Okay, well, Hashimoto's is basically you have an inflammatory infiltrate into the thyroid gland that destroys the thyroid cells, and eventually you may experience hypothyroidism, meaning that the thyroid just doesn't have enough cells to produce the levels of thyroid hormone that are necessary. So symptoms can consist of fatigue and weakness, weight gain, muscle cramps, cold intolerance, constipation, depression, mood swings, particularly with irritability, and diminished libido or sexual desire and arousal. So CBD can help with a lot of those symptoms, in that it can help to modulate that inflammatory response. It certainly can help with symptoms like muscle cramps and pain. And CBD also modulates GI motility. So a lot of the scientific data looks at CBD as slowing down peristalsis, and we use it a lot for patients with increased output or with diarrhea. But it also, we have found, just anecdotally, observationally, that patients who are constipated report back that they have a much easier time of having bowel movements once they start on CBD. So CBD really won't change thyroid function. Thyroid function will be helped by taking something like an exogenous thyroid hormone like levothyroxine, but it certainly can help manage the symptoms.
So you've touched on something important. It seems like there's a pattern with autoimmune diseases, which is inflammation.
Yes.
And so beyond CBD, which is obviously a powerful anti-inflammatory, you talked about how it's more powerful than prednisone. What are the other supplements that people can introduce into their daily regimen to reduce inflammation? I know that you've talked a lot about the omega-3s, for instance.
Yes, well, because the American diet is very heavy in omega-6, and omega-6 is inflammatory, we need a certain amount of omega-6 to make these, even our own endocannabinoids like anandamide and 2-AG, but too much omega-6 actually downregulates the endocannabinoid system, which is the system in our body that's there to modulate all of these other neurotransmitting systems. So if we increase omega-3, we're getting a better balance, and it should be about 4 to 1, omega-6 to omega-3, but the standard American diet that we affectionately call SAD is the ratio is more like 16:1. So we're getting way too much omega-6. And so this modulating system, this endocannabinoid system, just cannot function as well. So by moving towards a plant-based diet, and you have to be picky about the plants, they should be organic, pesticides downregulate the system, limiting your animal protein to healthy animals that are grass-fed, that are not fed these omega-6 rich grains day and night, by exercising, by getting good sleep. All of these things can help reduce inflammation.
That's great advice. And we're going to move on to the next question, which is, can cannabis improve the quality of life for those living with lupus? And maybe we could touch on what exactly is lupus, too.
Well, lupus is an autoimmune illness, and it causes a lot of joint pain. It causes a lot of the other symptoms that other autoimmune illnesses or patients experience. It can affect the kidneys, and it can affect the lungs, it can affect the brains, it can have infiltrates in almost any organ system. And it's not, I really can't address quality of life issues because everyone is different. But certainly I do have lupus patients who use cannabis, both CBD or CBD and THC, or sometimes just THC. THC can be very helpful in alleviating pain. It can also help them sleep. It can elevate their mood because they many times are depressed. And the euphoric high of THC can sometimes be a respite for people who just don't feel good most of the time. That kind of getting out of themselves and just kind of enjoying the euphoria, if that's an effect that THC has on them, can be very helpful. So all of those things for some patients does improve quality of life. We're not really curing the disease, but we're certainly making it a lot easier to live with.
Well, you and I often talk about how cannabis isn't actually a silver bullet, but it is something that can be a helpful addition to whatever you're doing. And so the next question is, how can cannabis help people with celiac disease?
Celiac disease is a severe form of gluten sensitivity. And in this country, we have a lot of patients who are gluten sensitive, and this can cause inflammation in the GI tract. It can cause abdominal pain, diarrhea, and the other symptoms that we talked about, fatigue, brain fog. CBD is, as I said, is a potent anti-inflammatory, and the GI tract is full of receptors that CBD activates. So the main thing is that they have to eliminate gluten.
No gluten.
No gluten. And we really should be, and I didn't mention that sugar is inflammatory, so we really need to watch the sugar in our diet too. We need to get rid of that sweet tea and a lot of the sugary treats, that processed foods that have hidden sugar, because all of that is inflammatory. But removing gluten from the diet and using CBD can definitely help with decreasing inflammation in the GI tract. CBD is very good for what we call visceral pain, which is pain in the organs of the body, not necessarily the muscle or the bone. And it is a good modulator of peristalsis, or the way that the intestines move food or waste. So patients who have diarrhea, the CBD oftentimes will decrease the output so that they can better absorb the nutrients that they are getting. And so it can help with weight gain, it can help with abdominal pain and inflammation.
Fantastic. Thank you for that very thorough answer. And I just want to remind everyone in the audience that if you have a question about cannabis and autoimmune diseases, please use our live chat. Type in your question there, and if we can get to it, we'll ask Dr. Frye live right now. or after the live stream is over, she will be answering questions as well as our other HelloMD doctors. So I just got this in that a lot of people are asking in the chat about dosages for autoimmune diseases. So I know this is a tricky question to answer, but what do you have to say about methods of administration as well as dosage?
All right. Well, it's a little tricky because of not having that doctor-patient relationship, and because people respond to cannabis differently. I think that when patients with autoimmune disease really want to turn to cannabis for helping to either attenuate their symptoms or just to feel better, they really should think about maybe either a telemedicine consultation with a HelloMD doctor or with an educational consultation where the doctor can maybe address the responses a little more specifically to that individual case.
Well, also there's some concern about whether people are on other medications as well, because there is some interactions there.
There are a number of drug interactions with CBD. So you really should get some medical guidance when using it. But what I can say is that you have to start with a low dose and keep pushing that dose up until you start to see that your symptoms are responding. And typically that dose is in the 20 to 30 milligrams twice a day, but that's going to be there are going to be patients that are going to do well with a much lower dose. There are going to be patients who are going to need much more than that.
Isn't consistency also important with CBD? It's not just a take it once, one day, and then you're done. You have to continue and take it consistently before you see the effects.
Yes, I usually recommend that patients take it twice a day. I do recommend tinctures because the oils can go right under the tongue, and a lot of that medication is absorbed directly into the bloodstream through the little capillaries in the mouth. The rest is swallowed and absorbed through the intestines, which extends the length of time that CBD is active. So I typically recommend patients take it at least twice a day and for several months before backing off.
That's good to know. So we have an audience question here. Do you have to take CBD/THC every day, or can it still help if you only take it when you have inflammatory pain? Well, I think we may have just talked about that.
We talked about that. You need to take it every day, but while taking it every day, if you have a flare-up, you can certainly address that symptom either with more CBD or a CBD-THC combination. And with, let's say, abdominal pain, that's when I would suggest maybe using a capsule. And the reason is that when you use a capsule, well, cannabis, these cannabinoids are fat-loving, so they're not really well absorbed from the intestines unless there's a fatty environment, like you've had a fatty meal. The environment in the intestines is mostly aqueous or watery. So a lot of that medicine stays in the intestines, it never gets absorbed. And so when you're having issues like abdominal pain from intestinal inflammation or from hyperperistalsis, where everything's spasming and causing discomfort, actually having it sit in the intestines can be a great benefit. So you can spot treat with cannabis in addition to using your basic CBD dose on a daily basis.
All right, and I'm going to use that word aqueous.
Oh, right.
That's a good one. I'm going to use it at least 3 times today.
Okay.
An aqueous environment.
There we go.
All right, so here's our final question. Oh, wait, not the final question. We're close to wrapping up, but we have one more. Did you know?
Okay.
So women tend to be healthier and live longer than men.
Yes.
They are also less susceptible to infectious diseases, but on the other hand, 80% of individuals with autoimmune diseases are women. This higher prevalence is partly attributable to the X chromosome, which has many genes relating to the immune system.
Yes.
I didn't know that. You knew that.
Okay.
But 80% of people who have autoimmune diseases are women. And they're sure that has to do with the X chromosome. All right. Nothing more to say about that.
I don't have
we live
anything
longer
to
with
add.
autoimmune diseases. All right, so the final question. So what overall lifestyle changes can someone with an autoimmune disorder make to improve their overall health?
The first thing is food. The very first at the top of the list is looking at what you're eating. It's very important to reduce or eliminate the processed foods, the fast food, junk food. You want to get sugar out of your diet as best you can. Processed foods have a lot of hidden sugar. There are certain foods that tend to be inflammatory and are often the culprit in initiating these inflammatory responses. At the top of the list is gluten. Then there's dairy, soy, corn, tomatoes, grapefruit, peanuts, not other nuts, but peanuts, and then unfortunately shellfish. So, so patients should consider doing an elimination diet, either taking those things out of their diet one at a time to see if there's any improvement in their symptoms, or taking them all out. It takes a lot of planning to do an elimination diet. There are doctors that practice integrative medicine or functional medicine that can often do testing to check for food sensitivities that might be stimulating this immune system. So that's first and foremost. You have to be careful also with nightshades, so white potatoes, which I recommend not eating because of the sugar, tomatoes, and bell peppers.
Eggplant too.
Eggplant too. That's
and mushrooms, correct?
Are mushrooms are not
Maybe somebody in the audience can tell
nightshades?
us that. I think they are a nightshade, but I could be wrong.
They're
But-
a fungus. But anyway, we'll look that up.
We'll look it
Yeah,
up.
we'll get back to that. But diet is first and foremost. The next thing is exercise. You need to move your body to help your endocannabinoid system function better. There are mind-body techniques to help with things like anxiety and stress that and these often exacerbate symptoms in autoimmune patients. So even cognitive behavioral therapy, meditation, taking time to do things like yoga, tai chi, all of these things, biofeedback can really help you with these anxiety levels. And also, speaking of stress, taking that daily CBD will actually interrupt that stress response, which is an important response if there's a bear in the room. But if there are no bears around, we don't need to be ready to run. So those are what, and then a good night's sleep. You have got to sleep and drink water. And if you look at your diet, you sleep, you rest, you do things to help you relieve your anxiety and relieve your stress with the mind-body protocols, people often feel better.
Well, that's great. As always, I learned so much when we hang out together, and today, same thing. I've learned so many new things about autoimmune diseases. I hope that you did as well. Again, if you have more questions about cannabis and autoimmune diseases, feel free to keep typing in the chat, and Dr. Frye or one of our HelloMD doctors will continue to answer after the live stream. But for now, that's a wrap. I hope that you tune in the next time for our Ask a Doctor series, and that's it. All right, everyone, take care.